Hello. Welcome if you're new here. I'm Dr. Tiffany Woodus, and I'm a wife, a mama, and an OBGYN on a mission to help eliminate women's health disparities. This channel was created to educate, elevate, and empower you to take back control of your health narrative. So if that sounds like something you're interested in, do me a favor and subscribe below. Like many of you, I can barely contain my excitement about the news of the Biden-Harris victory. The people have spoken, and we have made it abundantly clear that we've had enough of the racism, xenophobia, misogyny, homophobia, and blatant disregard for science. We got our seat at the table, and now it's time to get to work. As Black women, we have to unite to make sure that the issues that directly concern us are at the top of the agenda. Senator Harris, now Madam Vice President-elect Harris, has long been an advocate for women's health issues. Now that we are in there, we must have an agenda. We must be well-versed in the issues that matter the most to us. We must have and push forward a plan of attack. Without a plan, the people perish. Let's get it. I want to start by helping you understand the Senator's track record on the top Black health issues that directly impact our health. Let's start by discussing the Senator's stance on improved access to reproductive health care. In spring of 2019, Harris co-sponsored the Women's Health Protection Act. Access to women's health services, including safe, legal abortion services, is critical and crucial to a woman's ability to fully participate in economic and social life. Let's go deeper. Here's why this bill is important and why it should matter to you. Since Roe v. Wade in 1973, the Supreme Court has repeatedly defended the constitutionality of a woman's right to choose. Despite this, access to safe, legal abortion services has repeatedly been hindered across the United States in a variety of ways. This has included everything from physical blockages to violence to restrictions on insurance coverage. A 2018 study from the National Academy of Engineering, Science, and Medicine found that all forms of abortion are safe and effective, and the biggest threats to the quality of the services are the regulations that create barriers to the care. In fact, many of these regulations have nothing to do with protecting the health and the safety of the patient. According to the American College of Obstetricians and Gynecologists, a woman is 14 times more likely to die in childbirth than she is receiving abortion care and services. In places where abortion is illegal or highly restricted, women often resort to unsafe means in order to end an unwanted pregnancy, including relying upon abdominal or bodily trauma, ingestion of dangerous chemicals or medications, or relying upon unqualified medical providers. The American College of Obstetricians and Gynecologists estimates that prior to Roe v. Wade, 1.2 million abortions occurred in the United States each year, and about 5,000 women died from these unsafe practices. These restrictions have served to make access to these services more difficult, more costly, more dangerous, and more invasive. We cannot go back to that. Additionally, these restrictions harm women's health by restricting access to the other services provided by the providers under these restrictions, such as contraceptive services, which prevent unintended pregnancies in the first place and prevent the need for abortions, as well as cervical cancer screening and STD screening. Of note, Black women are 2 times more likely to suffer from unintended pregnancies. Who are the women who have been most harmed by these restrictions? Low-income women, women of color, immigrant women, young women, and women who live in rural and underserved communities. What else has the Senator done in the fight to protect our reproductive health? Harris has been very vocal about proposing funding to address the ridiculous backlog of untested rape kits. I was personally shocked to learn how big of a problem this is. Conservative estimates indicate that anywhere from 200 to 400,000 untested rape kits are just sitting in police stations nationwide. And let's not forget her children's agenda, which includes a plan for working families that allows up to 6 months of paid family and medical leave. There are several other things addressed in this plan that are not specific to reproductive health, but do benefit our families in general, and they include putting a cap on childcare costs not to exceed more than 7% of a family's income, no longer allowing juveniles to be tried as an adult, and placing a social worker and a nurse in every school. In August of 2018, she introduced legislation aimed at helping decrease the amount of Black women who die from largely preventable pregnancy-related complications. The bill is called the Maternal Care Act, and it does a number of things. It provides $125 million in grant monies towards improving access to quality care for all Black women. It also incentivizes healthcare providers who treat high-risk pregnancies in a timely fashion. It also provides another $25 million towards fighting racial bias in medicine by ensuring that medical schools, nursing schools, and other training programs include implicit bias training in their curriculums. In September of 2018, Harris, along with several other fellow lawmakers, introduced the Mommies Act. This act extends Medicaid coverage by providing coverage for a full year after childbirth. The goals of this bill are to decrease severe maternal morbidity and mortality, decrease unnecessary healthcare spending, decrease unnecessary emergency department visits, decrease disparities in maternal and infant health outcomes, including racial, economic, and geographic disparities, decrease cesarean rates for low-risk pregnancies, decrease the rate of preterm birth and low birth weight infants, and decrease the rate of avoidable maternal and newborn hospitalizations in the intensive care unit, all issues that disproportionately affect us. And let's not forget, in April of this year, Harris, along with several of her fellow senators, reintroduced legislation to designate the week of April the 11th through the 17th as Black Maternal Health Week to help raise awareness about the Black maternal health crisis. Harris also introduced legislation that specifically addresses combating maternal morbidity and mortality in the midst of the COVID-19 pandemic. Madam Vice President-elect Harris is also leading efforts along with several other lawmakers to push forth the Black Maternal Momnibus Act of 2020. This act is a collection of bills that focuses on the goals that we previously stated and further highlights the need to address maternal health outcomes among veterans and incarcerated women. It requires the Department of Health and Human Services to establish measures that directly examine social determinants of health, such as nutrition, transportation, and housing, maternal mental and behavioral health, and other topics that directly impact maternal health outcomes. It also implements measures to grow and diversify the perinatal workforce and improve data collection and quality measures to help better understand the maternal healthcare crisis and inform solutions. Last but certainly not least, Madam Vice President-elect recently co-sponsored the Medicare for All bill with Senator Bernie Sanders. This is a single-payer national healthcare plan that would provide everyone in America with comprehensive coverage. The plan includes everything, including reproductive and maternity care services. The bill highlights yet another issue that disproportionately affects Black women, and that is uterine fibroids. 50 to 80% of Black women will suffer from uterine fibroids by the age of 50. This bill provides funding for the research and education that we need to get the information and care we deserve. Whew, that was a lot. Now that we have an end, it's time to get to work, Mocha Mamas. We've done our victory dance, now let's get it. It's not enough to have a seat at the table. We have been given a unique opportunity to make our issues and concerns front and center. Let's make it clear that we expect to hear more about these issues, and more importantly, we expect action. Let's keep the momentum going. We are in there, ladies. Now it's time to go to work. Let's get it.